The Trump administration has issued two rules on price transparency in healthcare and coverage. One is a final rule, and we've talked about the proposed rule here together, and we'll link to that prior video in the description below. And one is a brand new proposed rule. Let's talk about the final rule first. And stick with me through the title. This is called the Calendar Year 2020 Outpatient Prospective Payment System and Ambulatory Surgical Center Price Transparency Requirements for Hospitals to Make Standard Charges Public. We're going to refer to this as the Standard Charges Final Rule. The name of the proposed rule that was issued is just called Transparency in Coverage. They have similar themes. One is directed towards hospitals, the other is directed more towards payers or insurance companies or health plans. Let's follow the history of how we got to this point, and like a lot of other rules coming out of the Center for Medicare and Medicaid Services and Health and Human Services lately, they started with an executive order, and this is no different. In June, President Trump signed an executive order that had a much easier title. It was just called Improving Price and Quality Transparency in the American Healthcare to Put Patients First. It was to increase the availability of meaningful price and quality information for patients. That's how it was defined. The order directed the Department of Health and Human Services to propose regulations to require hospitals to publicly post standard charge information. So in an effort to try to accomplish that executive order, we now have the standard charges final rule. The proposed rule came in the middle of the summer. The final rule is set to be published in the Federal Register. The final rule would simply require hospitals to provide patients with clear, accessible information about their standard charges for items and services. This, they say, will make it easier for consumers to shop and compare across hospitals. It's also, as defined by CMS, a way to maybe start mitigating some of those surprise bills that patients have been getting. If all goes well, this should begin in the start of calendar year 2021. Now, we say if this goes well, it will be implemented in 2021. Hospitals have already signaled that they do not like this rule and legal action may be forthcoming, but we'll talk about that in a moment. Now, this final rule, standard charges final rule, does require hospitals make public specific payer negotiated charges. So they have to show their math and their behind the scenes negotiation of how they reach the prices they have for certain listed items. The amount the hospital is willing to accept in cash from a patient for an item or service must also be made public. And the hospital also has to show the minimum and maximum negotiated charges for over 300 common shoppable services. And shoppable services are things like labs or x-rays. And the listing has to be of over 300 of these shoppable services that have to be made public. And the directive is make this public in a consumer-friendly way that's updated at least annually, maybe more frequently. And making it accessible in a consumer-friendly way is going to be the uphill challenge. Now, let's look at the proposed rule. So what we were just talking about was that price transparency for hospitals and providers. The proposed rule looks more at the coverage side of things. This is going to require most employer-based group health plans and health insurance issuers offering group and individual coverage to disclose price and cost-sharing information upfront to participants, beneficiaries, and enrollees. Now, this would be effective 1 year after the rule is finalized, and this was just introduced as a proposed rule. There will be a public comment period. Typically, those are 60 days. Then the CMS has time to review those comments, make any changes they want, and a final rule would be published sometime after that. So this is still a ways off as well. And again, insurance companies are not too happy with this proposed rule, and as some have indicated, they are looking at ways to litigate this as well. So that could push implementation back even further should that proceed. But let's look a little bit more at what it does. The Transparency and Coverage proposed rule says that information gives patients more access to estimates of any out-of-pocket costs. So health plans would have to disclose on a public website their negotiated rates for in-network and allowed amounts paid for out-of-network providers. And that's where a lot of people run into trouble with surprise hospital bills, is that in-network versus out-of-network providers and where they ended up getting their care. This would say that you have to see a lot of those details in advance, which would be very helpful for a lot of consumers. Also, the you'll need to make previously unavailable price information accessible in a standardized way and allow for easy comparisons, an apple-to-apple comparison. Now, for a lot of folks familiar with the Affordable Care Act implementing regulations over individual health plans, a lot of this language looks familiar. These are the elements of the Affordable Care Act that people really liked, having information transparent and accessible with a better understanding of some of your out-of-pocket costs explained and laid out in front before you actually get your care or before you even purchase your coverage. So a lot of what this transparency and coverage proposed rule is looking like is some of those popular elements of the Affordable Care Act. But then it goes off the rails a little bit when it also encourages health insurance issuers to offer new or different plan designs. And this is the quote, to incentivize consumers to shop for services from lower cost, higher value providers. So this could start looking like some of the elements of the outside the Affordable Care Act, some of those plans that maybe don't meet all of those essential health benefits. The Centers for Medicare and Medicaid Services might allow issuers to take credit for some shared savings program in their medical loss ratio calculations. That's that calculation of how much of the premium you pay has to be spent on actual claims by the insurance company. For the individual market, it's an 80-20 standard. 80% of what you pay in a premium has to be provided an actual claim, or you get a refund as a consumer. So the fact that CMS is willing to play with that ratio, taking other factors into consideration, might be a little worrisome, but it's something we'll follow as this moves its way through. Now, opponents, like we said, are all of the above. Hospitals and insurers. They don't like the proposed rule for insurers. Hospitals don't like the final rule impacting hospitals, and they give similar reasons for this. They said that these threaten that these rules will bring higher costs, that providers will demand higher rates once they found out what the competition is doing, and again, they'll pursue legal action now that, at least on the hospital side, that price transparency rule has been finalized. Now, proponents say you can never have too much transparency, and in fact, this is going to help patients shop for the better deal in healthcare. That could only help competition, not hurt it, like the insurance companies and hospitals are claiming. And there's actually teeth to this. There's actually an enforcement mechanism. So if a hospital or insurance doesn't disclose their rates, there's actually a penalty for that, a $300 a day penalty for not disclosing the rates as these rules provide. Hospitals largely say they already publish list prices. They say they shouldn't have to do the standard charge list because a lot of hospitals already have disclosed some of their list prices, but the consumer would say that means very little unless you actually know what the insurance is going to pay of that list price. So this is a conversation that's going to be ongoing, pitting hospitals and insurance companies against consumers and patient advocates. You can read some of these final rules and proposed rules. Let's talk about the final rule first. We link to it in the description below. We also share with you the CMS fact sheet, the Standard Charges Public Final Rule fact sheet they have put together, which lays out a little bit more of the background of why they view this as an important step to take right now. We also link in the description below to that proposed rule that's impacting more of the health plans and health insurers. We include also the fact sheet, separate fact sheet that CMS has put together on that transparency and coverage proposed rule. And we also in the description below link to that original executive order that got the ball rolling on all of these price transparency measures. Like we said, this has a ways to go. There will be public comment periods on both the final rule and the proposed rule once both have been published in the Federal Register. That will delay implementation a little bit until all those comments are taken into account and any changes are made. Once the rule is published in the Federal Register, at least on the hospital side, hospitals have indicated they will begin their legal action. We will keep you posted should that happen, so make sure you subscribe to stay up to date.